Alrighty, so with my pediatric patient with a supracondylar fracture, there are a couple outcome measures that I would consider using for this patient. A couple that I would consider include the American Shoulder and Elbow Surgeon's Elbow Outcome Score, the Broberg and Mori Elbow Scale, the Mayo Clinic Performance Index for the elbow, the Hospital for Special Surgery Assessment Scale, the Liverpool Elbow Scale, and also possibly the DASH. Um, a couple of these, the reasons why I would use them are the American Shoulder and Elbow Surgeon's Standardized Shoulder Assessment Form is a condition-specific scale that is intended to measure functional limitations and pain of the shoulder. So it would just relate to the joints around the injury for their function as well. I'd also use the Elbow Functional Rating Scale of Broberg and Mori, and so this includes a functional ratings index for evaluating patients following elbow injury and corrective surgery. The parameters they use are motion, flexion, pronation, and supination, strength, stability of the joint, and pain. And so you're just given a value and points for those specific functions of the elbow. And then also the Mayo Elbow Performance Score, which just tests the performance of the elbow in motion and function, and it does have strong reliability when assessed at different times and when compared with a validated elbow outcome instrument, such as the American Shoulder and Elbow Surgeon Score. And also the Liverpool Elbow Score is a possible questionnaire that can be used as well. It consists of a patient-answered questionnaire and a clinical assessment, and it has proven to have good correlation with other questionnaires and good reliability. And then last but not least, the Hospital for Special Surgery Elbow Assessment Scale. This would probably be my first choice out of all of the outcome measures that I would choose because it can be used to evaluate a person's elbow function. It can monitor the person over time and determine the effectiveness of a therapeutic intervention. So those are just a couple of outcome measures that are possible to use based on the research of their reliability and validity that I would use with my patient with a supracondylar fracture.